Time for our local update, and as I mentioned, we're going to be talking about the SINOVAC vaccine. Stay tuned. Have approved the SINOVAC biotech's coronavirus vaccine, the first shot developed for the disease by a Chinese company to be sanctioned locally. Now, SAPRA backed the double-dose coronavac candidate made by SINOVAC's Life Sciences unit with conditions, and that was made public on Saturday. Those include satisfactory results of ongoing studies and periodic safety updates. Now, I'm glad to be joined by a clinical researcher, advisor to NUMOLUX, a distributor for SINOVAC, and a virologist, Dr. Sanet Aspinal. Dr. Aspinal, good afternoon, and thank you so much for joining us.
Good afternoon, Fanas, and glad to be here, and good afternoon to your viewers.
No, it's an absolute pleasure to have you. Dr. Aspinal, I think the first question that needs to be asked is, this is massive, isn't it? We see, of course, policemen and policewomen getting vaccinated starting this week. Over 60s getting vaccinated, a lot of the public health workers getting vaccinated. This is another good step, isn't it, for the ages of 18 to 59? And I can say I'm quite excited because I'm over the age of 18, so this could really be a good starting point for potential herd immunity, isn't it?
Yeah, no, absolutely. The vaccine has been approved for adults 18 to 59 years old. We do not actually have a vaccine yet for children, but it is a good start in terms of having another vaccine available within the country, because at this time the South African program, the rollout program, needs more vaccines to be available to the public to help with introducing and expanding the herd immunity in the country.
Dr. Aspinal, the efficiency of the SINOVAC vaccine, I know there's a lot of concerns because we've seen Johnson & Johnson, there was a few problems there. We've seen Pfizer being quite effective, and especially after the second dose that's going to be happening. So just take us through SINOVAC vaccine and the efficiency of that and how this can help, especially those age gaps between 18 to 59.
Right. So in the clinical trials that have been done by SINOVAC in different countries throughout the world, the vaccine has been shown to be 100% effective against severe COVID, hospitalizations, and death. And that is what one actually wants in a pandemic. Against mild and moderate COVID infections, the vaccine has been shown to have efficacy ranging from 51% in Brazil up to 92% in Turkey and in other countries where the vaccine has actually been tested. The reason for the 51% in Brazil is that it has actually been done in healthcare workers, which is a high-risk population coming into contact day in and day out with COVID infections. And how the study was also being designed is actually because they looked at the whole spectrum of COVID infections in those healthcare workers, right from asymptomatic, being PCR positive, up until the high-end spectrum of COVID infections in those healthcare workers. And what they have found is that overall the efficacy was 51%, but in terms of hospitalizations, preventing death and landing up in ICU or being on a ventilator was actually 100% efficacious. So the efficacy really depends on a number of factors, and that is true for, in actual fact, all the vaccines. It depends on in what type of population the study has been done. It also depends on variants circulating at that time in the country, as well as the study design.
Dr. Aspinal, the doses that will be needed, so we see Pfizer, you need the double dose. So what doses will be needed for SINOVAC in order for there to be maximum efficiency of this vaccine?
So with the SINOVAC vaccine, the vaccine has actually been approved in 2 doses, and also it can be given in a 14 or a 28-day schedule, which is also good that if you want to protect people very quickly, you can actually give it in a 14-day schedule. So there's the 2 doses, either given at 0 and 14 days or 0 and 28 days.
Dr. Aspinal, the age groups of 18 to 59, and I think there's a unilateral agreement about it. These are predominantly the main ages of contributors to the economy of South Africa. So how important is it that vaccination of this age group happens to, kickstart the economy and get everything back together again?
So vaccination is the only way in which one can actually curb this pandemic. There's no other way to do that apart from, you practicing your 3 Cs, avoiding the crowded places, avoiding the close contact, and avoiding confined and enclosed spaces with poor ventilation. But vaccination is the only methodology to really curb the pandemic. And therefore, it is important to get the people vaccinated as quickly and as soon as possible. And that, I think, is the message for the people out there, is to really ensure that you go for your vaccinations once this product has also been rolled out. And obviously, it's going to take a little time still, because the vaccine must still be brought into the country and also be tested by the National Control Laboratory, as been done for all other vaccines in the country.
Dr. Aspinall, the storage of it, I think that's going to be important also. Like other vaccines, what is the storage with regards to that? Do you need cold storage? And how long, what is the shelf life? Because a lot of people, question, the shelf life of it. If you get the vaccines here, how quickly does it need to be, the dosages need to be put into the people's bodies before the shelf life ends?
So, fortunately, CoronaVac, the SINOVAC vaccine, needs to be stored at 2 to 8 degrees Celsius, so it doesn't need the high freezer temperatures of some of the other products that are currently out on the rollout, and therefore it's really a good vaccine to implement, especially in some of the rural areas within the country where you don't actually have these -80 freezers. The shelf life at this point in time, SINOVAC has actually got a shelf life of 24 months, and obviously there's some data that has been requested also by SAPRA to ensure that the shelf life can continue for 24 months. SAPRA has given an initial shelf life of 6 months to the vaccine at this point in time.
Dr. Aspinall, I want to come to a point that you brought in earlier about the efficiency. You mentioned 51% in some of the tests that have been done across the world. You mentioned Turkey being one of them. What's important is that 51%, I mean, it may seem a very small number, but it may be large to an extent where you can see that the trials and the vaccine rollouts that have happened in those countries is working, isn't it? And most importantly, the reduction of hospitalization, because what we need right now is less patients in the hospitals and an overbearing in a healthcare system that is at this moment quite fragile.
Yeah. So look, no vaccine is 100% effective. We're going to get breakthrough infections because there are variants circulating out there, and we probably don't know even about some of the newer type of variants that are going to come through. But all the vaccines are currently 100% effective against hospitalizations and death. And that is what one wants to prevent in a pandemic. In terms of the efficacy, SINOVAC, CoronaVac has also been shown to be 100% effective against severe COVID, hospitalizations, and death.
Dr. Aspinall, herd immunity, we see the importance of it. We've seen in Europe, herd immunity is slowly getting achieved. If you've been following the European Championships football, you've seen in Hungary that large crowds are starting to, get together. We see in Europe it happening. And of course, in South Africa, we'd like that to happen because we want there to be a return of normality. But in this third wave, how important does herd immunity become in achieving that, number one, and number two, getting our lives back to normal?
So herd immunity makes it possible to protect the population. That, I think, is very important. As people get vaccinated, the fewer people will remain vulnerable to an infection. And because we have all of these variants circulating and the infectious Delta variant, we want more people to be protected so that we actually have a population that is protected by herd immunity and who actually will will protect the vulnerable people also, because there will be less people then possible to spread the virus from person to person.
Dr. Aspinall, it's a question that I get asked a lot of times. If you get vaccinated, do you prevent yourself completely from getting COVID-19? And I think it's important as a virologist for you to just mention it again, that a vaccine is not a total prevention of getting COVID-19. Am I right in saying that?
Yes, the body needs time to make an immune response to a vaccine. And that happens only after, I would say, 14 days after your first dose. And then only are you able to launch an immune response. And that actually increases over time. So some of the vaccines are actually registered to be given in 2 doses. So you are not 100% fully protected after the first dose. You need a second dose to be fully protected. And therefore, one will maybe see some breakthrough infections after just 1 dose. You need 2 full doses for full protection. And as I've mentioned, none of these vaccines currently are 100% effective against all of the variants out there. And therefore, we may see some breakthrough infections even though you have been vaccinated. And therefore, if you have symptoms similar to the COVID symptoms, even after you've been vaccinated, just please go for testing and ensure that you do isolate. And I think in terms of, even if you are vaccinated, one still needs to protect yourself with a mask, and also needs to do the 3 C's, as I call them: avoid crowded places, close contact settings, and also confined spaces with poor circulation.
One final question, Dr. Aspinall, and you mentioned the 3 C's, and I ask every doctor that comes, and healthcare professional that comes to the show, just to, again, alert the public about, the real dangers of the current Delta variant and what they need to do in order to make sure that they avoid it. Just again, another plea, doctor, because I think, we see crowds still gathering, we still see people wanting to return to a normal life, not understanding the dangers and just how difficult it is with this new variant.
Yeah, the vaccine is available. People need to go. If your age group has been opened up for vaccination, please go and register and get your vaccine. I think that is number one. We cannot stop this pandemic without people being vaccinated. People still, that have got vaccine hesitancy, the best vaccine now is in people's arms. And I think, just to reiterate again, wear your mask, continue wear your masking, and practice the 3 C's. Avoid crowded spaces, avoid close contact settings, and thirdly, avoid confined spaces with poor circulation.
Dr. Sanet Aspinal, we say thank you so much for joining us. Much appreciated.
Thank you.
Dr. Sanet Aspinal, virologist, clinical researcher, and advisor to NUMOLUX, the distributor for the SINOVAC vaccine, just giving us a breakdown of this. Really, it's quite a monumental news that ages from 18 to 59 have an opportunity to get themselves vaccinated. Well, coming up after the break, we'll be moving to our international updates, and we'll be discussing China and its 100 years of communism. Stay tuned.